The nation's leading physicians group is contradicting the CDC as coronavirus infections continue to soar across the country. The president of the American Medical Association, a former Air Force doctor, says the testing backlog has left the nation fighting yesterday's war on the pandemic. By air, sea, and land, when the troops train, they train for the next war. So what does a former Air Force doctor who spent 3 years at the home of the 1st Fighter Wing in Hampton have to say about the war on the coronavirus?
It's much like fighting the next war. We're always seems like we're fighting yesterday's war.
Dr. Gerald Harmon, now the president of the American Medical Association, has joined forces with the Ad Council to spread the word about what he says is still a winnable war.
We can still overcome this. We can handle this transmissibility, but the best way to protect you from serious disease, illness, or death is get vaccinated.
But along the road to victory, Dr. Harmon says the CDC has created a potential setback by cutting the recommended isolation time for the infected from 10 days to 5 days.
That's confusing, and I think there's a risk. We have some data even from the CDC's website that shows as many as 1 out of 3 people are still shedding virus and contagious after 5 days. So I would worry that if we put a substantial number of people back into the workforce, into the school, we could spread unintentionally a fair amount of a highly contagious virus into the community and exacerbate the problem.
So what are the doctor's orders?
I tell my patients, and I recommend that a minimum of 7 days, but certainly 7 is probably more confidence to have in the absence, particularly of a negative test. And we have a shortage of those testing supplies.
And he has a weapon for the parallel war on the pandemic of misinformation and disinformation. He says check out an Ad Council website for reliable vaccine and public health measures to prevent the spread of the virus. I have that information on WAVY.com.